Hi, I'm Hannah, CEO and co-founder of ReSuture. My company makes sure that future surgeons get experience before entering the operating room. Right now, surgical training is inefficient and outdated. Sophisticated tools to train surgeons just don't exist. Surgical instructors tell us that because of recent regulations, residents aren't getting as many training hours in the operating room. A report last year found that almost a third of graduating surgical residents didn't feel prepared to perform all the surgeries that they had to know. This is such a big problem that while working at the Tulane Center for Medical Simulation, surgeons were asking me to create training products for their residents. What they needed were trainers that could really replicate specific procedures. In most procedures, surgeons will have to come across arteries and veins, whether they're operating on the vessels or managing bleeding. Right now, residents are suturing together things like socks and rubber tubes to practice vascular skills. In the 21st century, surely we can provide better training for our surgeons than this. My co-founder and I decided to use our backgrounds in engineering to create highly realistic models of surgical operations, focusing on replicating the details of a real surgery. We created a proprietary method to make vascular models that have the same physical properties as real human tissue. Users can practice suturing, stenting, and shunting. Incorporating 3D printing, we simulate specific disease conditions like plaque, thrombus, and aneurysms to replicate all the challenges faced in the operating room. Working closely with surgeons at several medical schools, we have developed the first comprehensive training system for open vascular surgery procedures. ReSuture is creating lifelike models that give surgeons hands-on experience in a controlled and monitored environment. These simulations can be implemented into a modular system with pulsing fluid flow to simulate blood. We deliver unique value to our customers by allowing them to practice specific operations in the most realistic simulated environment, all in the same desktop system. Current simulations lack either anatomical detail or the operable functionality necessary to provide adequate training for live surgery. For example, many surgeons train in porcine labs, practicing on live pigs. Forgetting for a moment the ethics and expense of these labs, while trainees can practice techniques on realistic live tissue, they cannot learn the details and steps of a real surgical operation. ReSuture's superior manufacturing method for synthetic vasculature allows us to replicate a surgical procedure with enhanced detail and realism, while also allowing us the flexibility to create custom and patient-specific models. Our primary customers are medical simulation centers associated with hospitals, medical schools, and residency programs. The deficiencies associated with surgical training extend into other healthcare sectors as well. Medical device companies also need accurate vascular simulations, as they are required by the FDA to train physicians on new products. They also use sims as a sales aid, opening up a lucrative vertical for ReSuture to move into. We are selling our system with recurring revenue through our consumable surgical cartridges. There are currently no other surgical simulation products that allow for the implementation of multiple procedures in a compact system. By offering these consumable replacement pieces, we streamline the training process at a lower price than our competitors. We've secured our first customer this month. Tulane was a pilot partner who has now come on as a paying customer. Pictured here are surgical residents from Tulane Medical Center using our products in their last simulation lab. The surgeon who ran the course told us he kept getting emails and texts about how much the residents loved training on our products, and they all said it was way better than the pig lab. After the success of these pilots, we are moving into sales. We're currently in talks with the simulation center in Texas and the medical device company W.L. Gore. In 2024, we're anticipating around $10 million in sales revenue with a gross margin of 87%. At this point, we anticipate not only having products for surgical training, but also offering models for the demonstration and testing of medical devices. We are asking for $20,000 to execute our sales and marketing plan. This will allow us to create crucial marketing materials and finalize our branding before moving into sales. This funding could greatly expedite our time to market and allow us to start generating significant sales revenue. I have a background in technology commercialization and biomedical engineering. Ben, my co-founder, is also a biomedical engineer who previously developed medical simulations for Tulane University. We have built strong surgical and business advisory boards, including Dr. Krista Coyne, a renowned professor of surgery who is heavily involved in simulation training, and Mitch Willett, the former COO of another surgical simulation company. It is our goal to create the most accurate procedural experience outside the operating room, allowing surgeons to perfect the necessary skills to provide exceptional patient care. Thank you.